let's be real for a second. For a lot of parents, taking your child to the dentist can feel, well, like you're gearing up for a battle, right? The anxiety, the tears, sometimes just the flat-out refusal. It's a huge stressor. But what if I told you there's a science to it? A whole playbook that pediatric dentists use to turn that fear into cooperation. Well, there is. And today, we're going to pull back the curtain and show you exactly how it works. So why? What is it about that chair that can be so terrifying for a little one? It's a great question, and the answer is way more complex than just a simple fear of the unknown. And you know what? Understanding what's really going on in your child's head is the absolute first step to a much, much more peaceful dental visit for everybody involved. So here's our roadmap. First, we'll dig into the why. What are the roots of this fear? Then we are going to open up the dentist's communication toolbox. It's fascinating stuff. We'll also look at special ways to help really anxious kids, touch on the more advanced options when they're needed, and then wrap up with the most important piece of the puzzle, the partnership between you and the dentist. All right, so what's really going on here? The experts, the people who study this stuff, say it's almost never just one single thing. It's more like a cocktail of different factors, all mixed together. And just look at how these things are all connected. That fear of the unknown, it gets way bigger if a child can sense their parents' anxiety. And you might not even realize you're sending those signals. A single tough experience at the doctor's office can cast a really long shadow. And sometimes a child just hasn't developed the coping skills for such a strange new environment. It's not about them being bad, it's about their developmental stage. Okay, so knowing all of that, how in the world do pediatric dentists manage these really complex emotions? Well, it all starts with a foundational toolkit. And this toolkit relies almost completely on communication, on empathy, and on building trust. These are the first, and honestly, the most important tools they've got. The absolute cornerstone of this whole approach is a brilliantly simple but incredibly powerful technique called tell, show, do. The entire goal here is to get rid of that fear of the unknown we just talked about. By breaking down every single step, the dentist turns something that could be scary into something that's predictable and totally understandable. And here's the magic of how it works in practice. Tell might sound something like, okay, this is Mr. Thirsty, and his job is to give your tooth a little shower. Show is when the dentist actually lets the child feel that little water squirter on their own finger first. And do is when Mr. Thirsty cleans the tooth exactly like they said he would. No surprises. And that one little sequence builds a massive amount of trust. But tell, show, do is just the starting point. It's really part of a whole ecosystem of communication. You've got ask, tell, ask to make sure the child feels heard and understood. There's voice control, which isn't about being loud, but about using a calm, steady tone to cut through the noise of anxiety. And then there's super specific positive reinforcement. Not just good job, but wow, you are doing an amazing job keeping your hands in your lap. That really empowers a kid. Now, these communication tools are amazing, and they work for most kids. But what about children who are just really, really anxious? Or kids with special healthcare needs who might get completely overwhelmed by a standard clinic? Well, that's when the approach gets even more tailored. This is where the environment itself actually becomes a tool for calming. A sensory-adapted dental environment, or SADE, is designed from the ground up to reduce all that stimulation. So instead of bright, harsh lights, you get dimmed lighting, maybe some calming projections on the ceiling. Those clinical sounds and smells, they're replaced with soothing music. Even something as simple as using a weighted blanket can provide this deep pressure comfort that makes a world of difference for some kids. And sometimes the very best tool has 4 legs and a wagging tail. Now, this isn't just about bringing a pet into the office. Animal-assisted therapy is a very structured approach. A certified therapy animal can be this incredibly calming presence, a fantastic distraction, and a way for a child who's maybe struggling to communicate to build a bridge of trust with the entire dental team. Okay, so we've covered the communication tools and the specialized approaches. But sometimes, for a small number of children who just can't cooperate, maybe because of their age, a disability, or just overwhelming anxiety, more advanced options are necessary to make sure they can get safe, high-quality dental care. Now, it is so important to understand that these techniques, things like protective stabilization, sedation, and general anesthesia, are never the first choice. They're kept in reserve for very specific situations where other methods just haven't worked, and the child's safety is the absolute #1 priority. The goal is always the same, to get the necessary dental work done without any risk of injury to the child or the staff. And all of this leads us to what is, frankly, the most critical part of a successful dental visit: the partnership. This is not something that just happens to your child. It is a process that you, the parent, are a central part of. The foundation of this partnership is built on something called informed consent. But listen, this is so much more than just a piece of paper you sign. It's a conversation. It's a dialogue. Especially when you're talking about those advanced techniques. Your dentist should be explaining every single option, all the risks, all the benefits. They need to be answering all of your questions because you are a key decision maker in your child's care, period. You know, this quote from the American Academy of Pediatric Dentistry just says it all perfectly. It's a three-way partnership. You have the dentist with all their clinical expertise, you have the parent who brings this deep, intimate understanding of their own child, and you have the child who is the focus of all of it. When those three parts are working together, that is when you get the absolute best outcomes. So let me leave you with this final thought. We've talked about all of these incredible tools and techniques that the dental team has at their disposal. But what if the very first and maybe the most powerful tool is actually yours? By understanding this whole process, by choosing your words carefully, and by managing your own anxiety, you can set your child up for success long before you even walk through that clinic door. You can transform a moment of fear into a milestone of trust.